This magnificent building houses Moyo Hospital COVID-19 Treatment Center with a bed capacity of about 30. The facility is one of the most organized treatment centers with high bed capacities, but the worst equipped hospital in terms of oxygen cylinders.
Actually, for COVID management, one patient needs all the 5 cylinders. For now, it means if we get a case in oxygen, which has been the case in the last few weeks, it is not possible for us to manage. We can only give pre-referral oxygen. Right now, what we need urgently is to have over 25 cylinders. That means we shall have a capacity to engage in at least saving 5 lives for 5 people who are severely affected by COVID. And we also have ventilators designed and developed in our rooms, but they have never been functional. We are requesting that the ministry should take it up seriously.
The hospital also lacks oxygen plant, and the nearest point to fill the cylinder is in Arua, which is about 150 kilometers.
Just send them messages that we are coming for oxygen, and then we have to look for suitable transport to carry those cylinders because they don't fit very well in our ambulance, which is the transport we have. At least if we had a pickup maybe, or a mini lorry, then they are able to refill. Refilling does not take us much from the other side. It is filled on spot, but the truth is the cylinders are not adequate, and also the supply is inadequate.
The medics at the hospital have also claimed that they have never received any medicines from government for treating COVID-19 since the outbreak of the pandemic last year.
And all the patients buy their medications. In totality, we have no special supply for the hospital, neither do we have a budget. If we are to interfere in that budget, it means stock out will be overwhelming the hospital and it will not be useful enough for or beneficial to the rest of the communities. So we have not received any drugs at all, if not even from the regional north, but we got some few from the communities that gave us here, which could not be sustained. At the same time, we are also unable to provide food for those who cannot get. It is really a big problem.
It should be noted that Moyo district borders South Sudan, hosts thousands of refugees, and has more than 7 porous border points that exposes it to COVID-19.
Our coverage is wide. Obongi district has a health center 4. Obongi became a district 2 years ago. They have health center 4. In emergency cases, referrals are received here. Obongi Ferry is no longer working. Previously, we used to share the responsibility with the Ajumani district, Ajumani hospital, and Moyo. But now, because every pressure is on Laroki Ferry, so the nearest is here. The refugee community, the referrals are made here.
The Parliamentary Committee on COVID-19 that visited the hospital for an oversight role condemned the situation, blaming it on both local and central government.
Noting that a patient with severe COVID needs a minimum of 5 cylinders per day. That's a huge gap that must be addressed urgently. So we've guided the case management team to plan for and order for cylinders and work with the Arua Regional Referral Hospital and possibly Gulu Hospital and the National Medical Stores to ensure there are oxygen cylinders, but also need oxygen concentrators because there's only one oxygen concentrator that is working in the hospital.
Very big challenge that we've observed. They have 1 cylinder, but that's not even the biggest challenge. The biggest challenge is that refilling that cylinder itself, they need to spend about 400,000 shillings in terms of fuel to go all the way to Arua and get it refilled. The second option they have is to have it filled from national medical stores. We've seen that Jumani getting it refilled from national medical stores, which is a very long process, takes about 1 month for them to complete. So there is need to support them to have more cylinders as we look at future plans of having a plant to manufacture the oxygen locally.
Moyo has so far admitted more than 374 cases since last year, with 16 deaths and 288 recoveries. Philip Aguta, UBC News in Moyo.